Hey guys, welcome back to Medical Coding with Blue. Today's episode is interview questions for medical coders and tips for the interview process. If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, I offer professional coaching as part of the services that I do offer, and I have all of my contact information in the description box below. I offer resume rewrites, I offer medical coding tutoring, and professional coaching. Professional coaching is when I am working with a client and it's typically for interview prep. Sometimes people will reach out to me and say, Blue, I really get nervous on interviews, but I have an interview coming up. Can you go through this with me and help me? Yes, that's what I do. So some of the questions here are what I found on the internet, but some of the tips that I will be giving are some of mine that I typically share in these sessions. So if you're interested in setting that up, if you want to do a professional coaching session, my rates are in the description box below. So here we go. Okay, this information comes from betterteam.com. So I did an internet search on interview questions just to kind of see what else was out there. And this website came up with a couple of really good questions. So they also have a medical coder job description template. Now, I want to talk about these templates first because there's a couple of things that are wrong in this thing, but there's also things that you'll see in job listings. Like sometimes it'll say the candidate must know ICD-9, and no one has used ICD-9 since 2015, okay? It was retired in 2015. We went into ICD-10 in October of 2015, and we have been there in ICD-10 ever since. So if you see ICD-9, don't panic. No one uses it. It has been retired since then. So again, guys, don't worry about that. Sometimes it's that HR is the one that has to put the information out. And this is a template of what they have as a description for a medical coder. And obviously it hasn't been updated in years. So sometimes people just don't know and they'll just go ahead and send it out, not thinking that it needs to be updated, but it does. So if you see ICD-9, again, guys, don't worry about it. And so I'm going to read the medical coder job description template from betterteam.com. And I want you to see some of the things that don't make sense in here. Okay, so here we go. All right, it says, we are looking to recruit a competent medical coder to assist us with coding medical documentation for insurance claims and for our databases. The medical coder will assign required current procedural terminology, CPT, healthcare common procedure coding system, HCPCS, international classification of diseases, 10th revision, clinical modification, ICD-10-CM, and American Society of Anesthesiologists, ASA codes. There is no such thing as ASA codes, guys. Anesthesiologists use what is in the CPT book. Okay, so that obviously is wrong. If you see something like that, take a gander and look it up and you'll be able to figure out that, yeah, that's not quite right. But going on, it says you will assign ambulatory payment classification, APC, or diagnosis-related DRG codes. So what they did was they didn't say inpatient or outpatient, but we know APCs and DRGs are two completely different things, all right? So it says, to ensure success, you need to make judicious decisions on which codes to assign in each instance and function to a high level of accuracy. This I agree. Top candidates are motivated or detail-oriented and have outstanding people skills. This is very true. Medical coder responsibilities: extracting relevant information from patient records, liaisoning with physicians and other parties to clarify information. Mostly the physicians. We're really not going to be working like with anybody else. Yes, we can get information from the nurse, not a lot of information from the nurse, but typically we are working with the physicians only. Examining documents for missing information, assign CPT, HCPCS, ICD-10. I'm not saying the other one because it doesn't even make sense. Codes, right? Assigning APC and DRG. Again, DRG has everything to do with the inpatient side of the house. And so, again, it's not really clear about what they're wanting here, other than the fact that they're going all over the place. Ensuring documents are grammatically correct and free from typing errors. Performing chart audits, advising and training physicians and staff on medical coding, informing supervisor of issues with equipment and computer program, and then ensuring compliance with medical coding policies and guidelines. Medical coder requirements: high school diploma, GED, or a suitable equivalent. 2 years of work experience as a medical coder, blah, blah, blah. And then it just says American Academy of Professional Coder Certification. So it may be that they work with AAPC and they don't, want to promote AHEMA. But again, guys, when it comes to certified medical coders, you want to be certified with the American Health Information Management Association or the American Academy of Professional Coders. One is not better than the other one, guys. One is not better than the other. All you need is one certification. You only have to be certified through one association. If anybody tells you you need to be certified through both, they're wrong and run. I'm just saying. Strong people skills, proficient computer skills, excellent communication skills, both verbal and written. What have I said about my tips for the resumes? Yeah. Outstanding organizational skills and the ability to maintain the confidentiality of information. Makes sense, okay? So the questions that they have on their website is, they have the top 5 interview questions, right? It says medical coder interview questions. Top 5 medical coder interview questions with detailed tips for both hiring managers and candidates. A medical coder assists healthcare facilities to convert patients' details to standardized codes in their databases and on documentation for medical insurance claims. Preferred candidates are meticulous, knowledgeable, and excellent communicators. Avoid disorganized, careless applicants. This is true. So it says the number 1 question they said is an interview question. Can you perform to a high level of accuracy, and why would you say so? So when you think about this question, of course, you're going to do everything in your power to code to a high level of accuracy, but you want to make sure that you can verbalize that. It's not that you're going to be like, yeah, sure. No, they want to know why. They want to know how. And you can start off by saying, the best way that I know how to be highly accurate and to code those things accurately is to make sure that I stay on top of my coding guidelines, refer back to the coding guidelines if I have a question, make sure that I research through Coding Clinic or a CPT Assistant if I get stuck on a particular procedure question. Reference books like the Coder Desk Reference for Procedures or the Coder Desk Reference for Diagnoses to support or to help me understand as it puts it into layman's terms. They want to know why, and not why, but how you're going to be able to be accurate. Not just yes, they want to know how. So telling them that you know about Coding Clinic, CPT Assistant, and using references like the Coder Desk Reference for Procedures, the Coder Desk Reference for Diagnoses, the Coding Companion, all of these things are helpful in helping them to get more trust that you know how to find the answers. You don't have to know everything, folks. And you don't even have to show like you know everything. Some people say, well, Blue, I feel like I'm lying. How are you lying when you've had the training for procedure coding, diagnosis coding, you know your coding guidelines, you've been able to pass a proficiency exam as far as like getting a certification? How is that lying? And then when I don't see things like that are basic for us to know, medical terminology, anatomy, and pathophysiology, when I don't see these on people's resumes, I question, do you know what this is? And so when you're in an interview, they are going to ask you those things because they want to make sure that you know. And being a brand new medical coder, they're going to question you and they're going to push you to see how much do you know. But if you don't know it, how can you find the answer? And that's the key right there, guys. So you got to be able to articulate that. I'm just saying. And then their advice is, it is essential for medical coders to perform accurately. Listen for the applicant to display this ability. So it's telling a coding manager who may be looking for questions, and they say, okay, well, this is a question I could ask. Then they're going to say, okay, this is what I need to listen for. So again, it's the coder's ability to be able to find the answer is what they're looking for to the answer to this question. And can you give me examples from past experience where you maintain confidentiality of sensitive information? And it says medical coders work with confidential information. Therefore, the potential hire needs to convince you of their ability to employ prudence regarding this. Okay, now here's the thing. Blue, I've never worked in a medical environment before. No, I can't maintain the sensitive information. Okay. Did you work at a restaurant? Did you work at Dollar General? Did you work at Walmart or some other department store? Okay, you did? All right. So did you handle credit cards and credit card receipts and those types of information? Yes. There you go. You're not sitting there willy-nilly with all these people's information all out, right? No, you secured those receipts. So you kept confidential information confidential. If there was people that maybe you were a hostess and you were responsible for keeping this guest list secure, because not everybody needs to know who's on this guest list, right? Think about that. Or if you had to secure other things, if you worked, in an office before and you had to keep the patient information, if you're coming from like being a medical secretary or something and you had to keep patient information private, talk about that. Talk about, making sure that the receipts are secure, making sure that if you saw anything, if you happen to go into an office and let's just say that you worked at Dollar General and people's payroll was out, right? There was a book that was open and there's payroll out, for everybody to see. But you went in there and you secured it. You closed it up, you put it away, you put it in a drawer. That's securing private information because that's people's, private social security numbers and things like that. So, anything that you had to be able to keep private. Did you work at the church? If you worked at the church or you volunteered at the church and you had to keep all of the donations that came in, that people made, the amount of money that they donated, you had to keep that private, right? So that is another example of you being able to secure people's information. If you volunteered like at a school and you couldn't say, obviously, that, okay, yeah, this student is in my class, that student is in my class. Okay, again, that's being able to keep private information private. Basically, they want to know, can you keep a secret? Yes, because you have to be able to guard patient information at all times. If we have to consult each other to figure out a code, you can speak about a patient in general terms, but you cannot say, oh, I have this patient, this patient, this patient in specifics and show you because everything is on a need-to-know basis. So if you ever operated on a need-to-know basis and you are able to secure any information, it doesn't have to be as sensitive as medical. It could be as sensitive as somebody's address or a guest list, something, that is private information. So they're wanting to know, when have you ever kept information private and can you do that? Okay, it's about getting creative here, folks. Number 3 is, could you give me a detailed explanation of CPT, HCPCS, and ICD-10 codes respectively? They want to know if you know what each of these books houses. What is the ICD-10-CM book? What is it for? And even though you might be a little insulted, like, really? They're really questioning me on this? Yes. Because believe it or not, some people get these books confused. The HCPCS book and the CPT book I've seen confused many times. I've actually seen the ICD-10-CM and the CPT book confused. Now don't laugh, because if you're not being taught well, it's possible that you can get the stuff confused. So again, can you explain what each one of these books is? So yes, you can. And you could talk about ICD-10-CM, that is for diagnoses, and that's how you start looking up your diagnosis codes, anything that having to deal with the diagnoses. CPT is all of your procedures, and it also houses the evaluation and management codes in it. That is very important. That may just saying that part may set you apart from anybody else. Okay, so it's about the details. CPT is for your outpatient procedures and your evaluation and management. Your all of those codes are in there. Okay, so just make sure that you look at that. Your anesthesia codes are in there. And then it breaks down. Okay, and then of course your HCPCS book. What is your HCPCS book for? That's your durable medical equipment. That is for procedures, also as well, for certain insurances, like with Medicare. Medicare has their colonoscopies procedures housed in the HCPCS book. So again, that's something that you can show to be like, okay, so I'm detailed enough to know this is what is in the HCPCS book. This is what is in the CPT. This is what is in the ICD-10-CM book. And if they ask you about anesthesia, let's just say they're trying to mess with you and say, what about ASA codes? Really? That's not even a thing. Anesthesiology codes are in the CPT book. I'm just saying it. The next question is, would you say you are a people person and why? Now, for some people, they say, well, Blue, I'm a very shy person. Okay, it's okay to be a shy person. Hello, I'm a shy person. Me personally, I am. But it's all about, can you communicate when you need to? And here they say medical coders need to liaison with various parties to gather and establish the accuracy of information. The applicant will assure you of their people skills in this answer. So if they're asking you, are you a people person and why? If you need to be able to communicate with somebody, work is work, your personal is your own personal. That can be left at the door. So you can be a shy and private person outside of the office, but when you're in there, you need to be able to communicate and ask questions. And that's what they're asking you here. Can you do this? Yes. Have you worked with many different personalities? Yes. Or even if you haven't, or maybe you just never thought about it, right? Again, if you work at Dollar General, you work around a lot of different personalities, and being able to handle different types of egos is very helpful in this industry, because not only do you have to work with other medical coders, but you do have to work with your providers. And these are some of the most intelligent people that you will ever work with in your whole life. And they are different, especially when you start working with these surgeons, boy. These surgeons are something else, and they have their own personal quirks, and they're very quirky, but they communicate differently, and you'll know what I mean when you start to work with them. So that's what they're wanting you to expand on. How would you train physicians and other staff on medical coding? Now, before you panic, do not panic. It is a hypothetical question. They're not going to expect you to go in there and start teaching classes, okay? But they want to know, how would you train physicians and other staff on medical coding? The prospective hire's answer should give you confidence in their ability to train others. Can you teach what you know back to the person? If you do, this means that you have mastered that understanding of the subject. And that's what they want, because every medical coder in theory should be able to teach what they know. Once they've completed a program and once they've gotten their certification, you should be able to explain to me, a layperson. If I'm a layperson, you should be able to explain to me what evaluation and management is. You should be able to explain to me how to look up a code in the book. You should be able to explain to me what a coding guideline means and what it is, right? Is specifics. If there's a specific guideline that we're talking about, you should be able to explain that to me. This is not hard, folks. This is not hard. Being able to explain back things is not hard. All right. So that's some of the questions that you may come out with, that they may ask you. Some, if you are applying for a specialty place, like an orthopedic place or urgent care or a cardio place, they may ask you specifics about those types of settings, right? So with urgent care, they're going to ask you, are you familiar with coding for injuries? Are you familiar with coding for sniffles and just plain respiratory problems, just minor things like that? If you are, that would be what they are going to really look at. Somebody that does those types of things when they're coding for urgent care. Somebody who's in cardio, obviously they're going to want them to be really good with the cardio section. And if you're not really sure about yourself with the cardio, start reviewing that in the CPT book, right? Because you need to get good with it. You need to immerse yourself in that particular subject if that's where you want to work. Same thing if you want to work for an ortho clinic. Hello, ortho coder here. If you want to work in an ortho clinic, that is a great place to start, looking in the ortho section and looking in the podiatry codes as well. So that way you can get familiar with those, and then you can get more familiar with those injuries. If you're applying for an emergency room department coder, you need to be really good with coding traumas, and you need to be good with coding like for basic things as well, broken arms and sprains and things like that. So those are some of the things that you can expect when you're applying at different places. Also, know where you're applying. If you're applying for a hospital, at least have a basic idea of when that hospital got started, how many beds are there, what kind of services does this hospital provide. So that way you can go in armed with that knowledge, because they may ask you about that facility. Well, what do you know about us? And if you sit there and say, that's not good, guys. That's not good. You have to be able to say, well, I know this and I know that. Speak confidently. You don't have to know the whole history, but just go to the website page for that hospital or facility or urgent care and find out a little something. Do your homework. That's why the internet is there. So that way you can have be prepared when you are going into these interviews. Always ask questions. If they ask you, do you have any questions for us? You better come out with a question. I don't care if it was, how are you today? So that you can think of another question while they're answering you and looking at you like you're a deer in the headlights. But you have to ask a question. If you say no, then okay, next candidate. This person wasn't really interested in what we have to offer. Because your body language says everything. And even if you are doing it over Zoom, you need to be sitting there and paying attention, looking straight at the camera. Don't look at the screen, the computer screen, but look at the lens of the camera, because that's when you're speaking to the person. Okay. Try not to have any chaos in the back going on. Make sure that you are backed up against a wall and it's clean, so that way there's no distractions if you're having to do a virtual interview. All right. Always be polite. Always be well-spoken. Speak up when you are in an interview. If you're mumbling, again, it's not going to look good on you. You need to be as clear and as articulate as you possibly can. I don't care if you have to feel like you're faking it during the interview because you're so nervous. The point is, you have this skill. You have something that this company needs. And you need to be able to tell them, yes, you do have it, because they're not going to assume that they know you and that they know that you have this skill. So that is my advice anyway. Make sure that you are well dressed when you go to these interviews. You know, do like the neutral colors, obviously blues, greens, tan, brown, that kind of thing. Those are good colors. Stay away from red. So again, guys, be well dressed. No jeans. I can't believe I have to say this, but people actually have told me, Blue, yeah, I shouldn't have went in jeans. Don't ever go in jeans, guys. This is the medical field. This is health information, and we need to be well dressed because we are going up against very intelligent people. And how you dress and how you present yourself is going to be how they will treat you. If you look like you're going to a rock concert, they are not going to go to you for medical coding questions. I'm just saying. Anyway, I'm going to go ahead and wrap this one up. If you like this video, if it helped you, I hope that you like it. Subscribe, share the video, and I will see y'all on the next episode. Bye.